Aisha has a question that many people are interested in. She says, I had an HSG performed and apparently have proximal blockage on both my tubes. I was then advised that IVF is my only option. Is this true? Dear Aisha, IVF is not your only option. Stay tuned and I will explain. An HSG is an X-ray test performed on women with infertility to determine if the fallopian tubes are blocked. A catheter is inserted into the uterus and fluid is squirted inside. The fluid, which is called contrast, will show up on X-ray. So if the fallopian tubes are open, you can actually see the fluid flowing into the tubes, go through the tubes, and out the other side. If the tubes are open, doctors will say they are patent. You can tell if there is a blockage because the fluid will flow up to the point of the blockage and then stop. There are two common spots where tubes become blocked: at the beginning of the tube and at the end. The beginning of the tube is where it is attached to the uterus. Doctors will refer to this as proximal blockage. Remember, with proximal blockage, you will not see any fluid flow into the tube at all. Aisha's doctor told her that she would have to do IVF for this problem, but that is not true. Most of the time, proximal tubal blockage can be opened, and it doesn't even require surgery. It just requires another HSG. This is something I do all of the time. There are two techniques that can be used to open a tube. First, we place a catheter directly into the opening of the tube. This is called selective salpingography. This allows us to increase pressure right at the opening of the tube. Many times, this alone can be successful to clear material inside of the tube that is causing blockage. If that doesn't work, another step is to try passing a wire through the opening of the tube. This can dislodge tissue or mucus from the inside of the tube as well. Afterward, we can try squirting fluid through again to make sure that it goes all the way through. In my hands, these techniques are successful over 90% of the time, so those people have another alternative to IVF to try to get pregnant. A question that I get a lot is whether the tubes stay open after I open them. The answer is yes. We know this because we see people getting pregnant months or years later. Sometimes, if they haven't gotten pregnant, we will repeat an HSG. Most of the time, the tubes are still open. Listen, IVF is a perfectly good option for blocked fallopian tubes. It just isn't the only option for most. Infertility TV is your most trusted source for accurate information on infertility and miscarriage. If you are not a subscriber yet, hit the subscribe button right now. A new episode is released every week. Don't miss any episodes. You can also check us out on our website, ivf1.com, where you can become a patient.